Have you ever opened your medicine cabinet and wondered what each pill actually does? Or maybe you've heard names like Panadol, Augmentin, or Zyrtec, but you're not exactly sure what they treat. In a world where thousands of medications exist, it's easy to get overwhelmed. But what if we told you that understanding general medicine doesn't require a medical degree? Welcome back to the channel. Today, we're diving deep into a topic that impacts every single one of us: general medicine and their uses, complete with brand names you probably see every day. Whether you're trying to manage a headache, fight off an infection, or treat a chronic condition, there's a medicine designed for that purpose. But do you know what they are? More importantly, do you know how to use them safely? What are the most commonly prescribed medicines across the world? Why do some medicines go by different brand names even though they treat the same thing? And how can knowing this information help you or your loved ones make better health choices? If you've ever asked these questions or simply want to feel more confident the next time you read a prescription label, then this video is for you. Make sure to hit that like button, subscribe if you haven't already, and stay tuned till the end, because what you learn today might just help save a life tomorrow. Let's begin with one of the most common categories: pain relievers. Almost everyone has used them at some point for headaches, body aches, toothaches, or menstrual pain. Two of the most familiar medicines in this category are paracetamol and ibuprofen. Paracetamol, also known as acetaminophen in some countries, is widely available under brand names like Panadol, Tylenol, and Calpol, especially for children. It's primarily used for mild to moderate pain relief and fever reduction. It's gentle on the stomach and often recommended for people who can't tolerate stronger anti-inflammatory drugs. On the other hand, ibuprofen, sold under brand names like Advil, Nurofen, and Motrin, belongs to the class of NSAIDs, non-steroidal anti-inflammatory drugs. In addition to relieving pain and reducing fever, it also reduces inflammation. This makes it particularly useful for conditions like arthritis or muscle sprains. However, it can irritate the stomach lining and isn't ideal for long-term use without a doctor's guidance. So, here's a question for you. When you have a headache, do you instinctively reach for Panadol or Advil? Did you know one might be more suitable depending on the cause of your pain? Now let's move on to antibiotics, arguably one of the most revolutionary discoveries in medical science. These are used to treat bacterial infections, not viral ones like the common cold or flu. One of the most prescribed antibiotics globally is amoxicillin, which you'll often find under brand names like Amoxil, and in combination with clavulanic acid as Augmentin. It's used to treat infections such as pneumonia, bronchitis, ear infections, and even dental abscesses. The addition of clavulanic acid in Augmentin helps fight bacteria that produce enzymes to resist antibiotics. Another powerful antibiotic is azithromycin, commonly known as Zithromax. It's popular for treating respiratory infections and sexually transmitted diseases. What makes azithromycin unique is its long half-life. It continues to work even after you've stopped taking it. But here's the catch: misusing antibiotics can lead to resistance, where bacteria adapt and no longer respond to treatment. This is why doctors are increasingly cautious with antibiotic prescriptions. Have you ever stopped taking antibiotics halfway just because you felt better, or kept leftover tablets just in case? These small choices can have big consequences, not just for you, but for public health in general. Let's talk about antihistamines, which are medications used to combat allergies. From runny noses to itchy skin and sneezing, antihistamines are often a first line of defense. Loratadine, branded as Claritin, Olivert, or Norvasc, is a non-drowsy antihistamine used for seasonal allergies. Another one, Cetirizine, better known as Zyrtec, Reactin, or Sertraline, is slightly more sedating but equally effective. Then there's diphenhydramine, sold under Benadryl, which is more sedating and often used to help people sleep during allergic flare-ups. But antihistamines aren't just for allergies. They're also used in cases of motion sickness, insect bites, and even anxiety in certain cases. Which one do you usually use for allergies? And did you know taking the wrong one at the wrong time, say before driving, could seriously impair your alertness? Now, let's discuss medicines for the cardiovascular system, drugs that manage blood pressure, cholesterol, and heart rhythm. Atorvastatin, under brand names like Lipitor, Norvasc, and Sortis, is a statin used to lower bad cholesterol and reduce the risk of heart attacks. Another common statin is simvastatin, sold as *Osir or Simlop. For blood pressure, Amlodipine is a calcium channel blocker found in brands like Norvasc and Amlodipine, often used to relax blood vessels. Lisinopril, branded as Zestril or Prinavil, is an ACE inhibitor that lowers blood pressure and protects the kidneys, especially beneficial for diabetic patients. Have you or someone you know been told to take a tiny pill daily for blood pressure or cholesterol? Do you know if it's a beta blocker, ACE inhibitor, or calcium channel blocker? Understanding what you're taking and why is crucial and empowering. In recent years, mental health has taken its rightful place in medical conversations, and rightly so. Millions of people live with anxiety, depression, and mood disorders. One of the most common antidepressants is Sertraline, sold as Zoloft. It's part of the SSRI family, selective serotonin reuptake inhibitors, that work by increasing serotonin levels in the brain. Another is fluoxetine, Prozac, which has been around for decades and remains widely used. For anxiety and panic disorders, Alprazolam, better known as Xanax, is a fast-acting benzodiazepine, though it can be addictive if misused. Diazepam, Valium, and clonazepam, Klonopin, are also used for their calming effects. Mental health medicines can be life-changing, but they must be used under medical supervision. Do you know how long these medications take to show results, or what side effects to look out for? Now, let's head down to the digestive system. Whether it's gas, acid reflux, or constipation, modern medicine offers plenty of relief. Omeprazole is a proton pump inhibitor that reduces stomach acid. It's helpful for GERD, ulcers, and chronic heartburn. For quick relief, ranitidine, formerly sold as Zantac, was popular, though it has since been recalled in many regions due to safety concerns. For constipation, lactulose, Dufalac, and Bisacodyl, Dulcolax, are common options. On the flip side, loperamide, Imodium, is used to treat diarrhea by slowing down gut movement. How often do you self-medicate for stomach problems? And are you choosing the right solution? Many of these medications, while available over the counter, aren't meant for long-term use. Another vital category includes medicines for women's health. Clomiphene, Clomid, is often prescribed to women facing fertility issues. Hormonal contraceptives like ethinyl estradiol plus levonorgestrel are found in brands like Nordet, Alesse, and Xanax. During pregnancy, prenatal vitamins like Pregnicare support fetal development. Ladies, have you ever been handed a prescription and felt confused or anxious about what it does? You're not alone, and it's okay to ask questions. Understanding general medicine isn't about turning yourself into a pharmacist or a doctor. It's about taking control of your health, being an informed patient, and making safe, educated decisions. The more we understand what goes into our bodies, the better we can protect and heal them. So next time you pick up a pill, pause, ask, what is this for? What's the brand? What's the active ingredient? And what are the possible side effects? If you found this video helpful, please give it a thumbs up. Share it with someone who could use a little clarity around their medications. And don't forget to subscribe to the channel for more health content every week. Got a question about a medicine we didn't cover? Drop it in the comments below. We're here to help. Until next time, stay informed, stay healthy, and take care of each other.